How does tinnitus affect your patients?
Tinnitus can affect patients in a variety of ways, and for some people all they want is information, and with a recent onset they just need clear information and a sort of positive knowledge that it's going to get better. For other patients, they're caught in a classic cycle of anxiety. They've got really sort of hung up on it, and if it starts affecting them in any way, then they get hung up on the effects of the tinnitus rather than the tinnitus itself. So we have to work on the effects before we can actually manage the tinnitus, but one tends to follow the other.
And what is the referral process for a person with tinnitus?
Patients are referred either by the ENT doctors or by other audiologists. Very occasionally we'll get odd referrals from GPs who have seen ENT people before. And when they come, when we receive the referrals, we usually send out an information pack and an invitation for them to come along to a group. And in this group we invite about 10 people, and when they come along to the group, they're given information on tinnitus and its management. If they're not suitable to come one-to-one into the group, then we see them one-to-one. In the group we do it in 2 sessions. The first session we talk about the physiology of hearing, and then we have an opportunity for the patients to talk about their own experience of what's actually happened that's triggered the tinnitus, and they share that with each other and obviously with us. And then there's a break where the patients often get a chance to discuss things with each other, and then the second part we talk about management of tinnitus, where all the options of management are sort of laid on a table for them, so they're given the tool bag of things that are out there for them to decide on their own course of management. The emotional aspect is often a light bulb moment for them to recognise how sort of the stress has impacted on the tinnitus, and once they can recognise that within themselves, then they're on their own sort of management course really. And often they get that caught up in the tinnitus, they don't give themselves the opportunity to recognise how they're reacting to it.
What help do you provide for tinnitus patients?
When we see them for tinnitus management, there's 3 main areas that we cover. The first is counselling, where we talk about the reactions of tinnitus and their sort of thoughts and the effects of the tinnitus on them, and how we can maybe help them with those reactions. And the second part of tinnitus management is sound enrichment. That's looking at, first of all, how the environment affects their perception of tinnitus. So, you know, if they're working in a quiet environment, it's going to be more noticeable, and how it affects sleep in that way. And then we talk about how they can use sound enrichment to sort of change that environment and stabilise it while they're going through management of the tinnitus. And the third part of tinnitus management is looking at how stress impacts on the tinnitus, or tinnitus impacts on stress. So it's a bit of a chicken and egg situation, and making them more aware of the stress reaction and how relaxation can help.
What added value do you feel that hearing therapy provides to a tinnitus department?
I have the opportunity to provide a very safe environment for the patients to explore their own experience, because they're given a lot more time, and I can ask the appropriate questions to delve a little bit deeper than just through an audiological perspective. I'm helping the patients to offload things that they may not have recognised beforehand.